the heart is generating blood pressure. And you all know that our heart is contracting to push the blood into the arteries, and then is relaxing to be filled by the blood coming from the venous circulation. In our arterial system, when the heart is contracting, there is a peak of blood pressure, and this is systolic blood pressure, the value we are recording in the phase when the heart is contracting. But then we also have a second value, which is when the heart is relaxing, and the pressure that was stored in the arterial walls is given back to the blood, because these arteries are elastic in a way, and this maintains the flow, and this is the diastolic blood pressure. So we are recording, every time we measure blood pressure, these two values, which are represented to different moments of the cardiac cycle and to different moments also in the arterial circulation.
So, as Gianfranco just explained, what these two numbers we usually measure mean. One is the systolic, one is the diastolic blood pressure. And you may wonder, what do we consider normal? What is the blood pressure we would like most people to be roughly at? And to answer that question, I think, first of all, it's important that it's not necessarily a fixed number. It's a bit of a range of blood pressure. As you can understand, we need a certain level of blood pressure, obviously, to perfuse our organs to ensure that enough blood supply comes to our organs. And usually what we consider as an optimal blood pressure in somebody who's perfectly healthy, often, of course, young people, is below 120/70 millimeters of mercury. Millimeters of mercury is the unit we use to express the level of pressure in the system. And people, when we grow older, we tend to have higher blood pressure for various reasons. But overall, what we're trying to achieve in the vast majority of people is a blood pressure lower than 130 and lower than 80 millimeters of mercury for systolic and diastolic. These are perhaps the numbers to remember. And, the higher the blood pressure in general, obviously, the more likely there may be damage. The high blood pressure causes strain not only on your vascular system, but also on the organs that are being directly perfused from those arteries and the pressure, such as the heart, the kidneys, the eyes, and the vasculature in general.